Hi, I'm Kent Roundy. I'm a psychiatrist at the Utah State Hospital.
I'm Matt Bradbury. So, Dr. Roundy, we're doing this video series. We've talked a little bit about terminology. That's the last video that everybody's watched. And in that, we defined positive symptoms. Specifically, we talked about delusions and hallucinations. And I thought maybe for the purpose of this interview, if we could get you to talk to us just a little bit about delusions and hallucinations and the things that you do see in patients that are affected by schizophrenia, and maybe some of the struggles that family members go through, and how to handle that situation.
Wow, what a great question! And by the way, thank you for inviting me to be a part of the Omhi interviews. I'm flattered by that. Delusions and hallucinations are a significant part of schizophrenia. Most patients that have schizophrenia will have one, the other, and quite often both. Hallucinations can be of many types, but typically what they are is some sort of sensory input that's not actually going on. So the most common that we think of are people that are hearing voices. We call those auditory hallucinations. But there are many people that have tactile hallucinations. They might have feelings that they're being touched on their skin. Some people have gustatory hallucinations, flavors or taste sensations that aren't actually going on. Other people have visual hallucinations where they see things in the environment. Quite often, somebody might see a pattern in a wall or in something that they're looking at as well. So these hallucinations can be very broad, a lot of different kinds of hallucinations. Most patients, over time, at least once on medication, will be able to ignore the hallucinations or recognize the hallucinations as not being part of their mind, not being part of, let me say it a different way, that they'll see that as being part of the illness, at least in many cases. And these hallucinations can be very, very distracting. Right? They can make it so that it's difficult to focus on a conversation that you're having with somebody else because there's this running commentary going on in your mind about what's happening around you. It's very, very challenging. But it's really not uncommon to have voices at times of stress or maybe at night. So hallucinations are often one of the big markers that we're watching for illness recovery. Often one of the first questions I ask, how are you doing with the voices? Delusions are quite a bit more challenging. We've talked about in the past, or at least you have in your videos, about insight. That ability to understand what is real and not real. And this is probably one of the most challenging aspects of treatment of schizophrenia, is helping somebody whose reality is so firm, right? If I were hearing voices that told me something, if I looked out in the environment and I saw these things that proved to me the voices were accurate, it would be very difficult for me to believe somebody else. It would be difficult for me to set aside these delusional beliefs and try and believe somebody else, because my internal experience would be so different. So delusions can be very challenging at times. They are very, very widespread too, where we can talk about 4 or 5 different kinds of hallucinations. The delusions are innumerable. Some people have delusions that they're being observed or watched. And often in delusions, there's some grain of truth, right? We know that as American citizens, there's an electronic, kind of footprint that we leave, but it doesn't mean that somebody's invested in watching us. Our patients with delusions take that overboard and live their lives as if somebody is watching them so closely. Other people have delusions, perhaps that they're very wealthy when they're not, and that they have homes that they don't own. Some people have delusions that are nearly paralyzing or very demoralizing. I've worked with some patients who believe that people think the worst about them, that they're child molesters, that they're abusive, that they're criminals, whatever the case may be, right? And they're absolutely paralyzed by those delusions. I find that hallucinations and delusions are often cruel symptoms. And as treatment providers, as loved ones, sometimes it's difficult for us to be empathic, to recognize the situation that our patients and loved ones are in. And being aware of that and helping our patients and loved ones become more aware of their illness is really one of the great hopes of the Omhi video series, is helping patients recognize that, first of all, there's a lot of people out there with similar kinds of symptoms, a lot of people that have voices, a lot of people that have to take medications to have a meaningful life. And that if they can control those hallucinations and delusions, that maybe there can be something better for them. And that insight into trusting somebody else and knowing that there are other people out there in the same boat that have been able to take those steps, it's a huge deal. It's a huge step forward and can be all the difference, I think. So that's a very long answer to a very not so simple question.
All right. Hey, I just wanted to say thank you so much. This has been great. We're going to see Dr. Roundy back a number of times. And once again, I'm Dr. Bradbury.
I'm Dr. Roundy.
And thank you for joining us at Omhi.